I'm sure most of us have felt that fear, sitting down in the dentist chair, hearing the drills they're using next door, wondering how bad will it hurt when it's your turn. Well, stop it and go see Dr. Vincent Monticciolo instead. There's no fear at Monticciolo Family and Sedation Dentistry because you have the option to be sedated. And he joins us now with more. Okay, doctor, let's talk about this. Do all your offices offer IV sedation?
That is correct. We have 5 offices now. Number 6 is in the process, and we have sedation dentists certified in each office.
And what type of training or certification do you need to have to be able to do this?
Right. Obviously not every dental office can do sedation. The doctors have to be permitted by the state, so we have to do a lot of specialized CE and see patients. All of our doctors have been trained, university trained for their sedation permit, and then the state has to come in and certify your office. So you have to have all the emergency drugs, all the monitors. You have to be inspected by the state to get that permit.
Who's a good candidate for this? A
Well,
lot of people have a irrational fear.
there's a lot of fear, you know, so obviously the bigger ones are the dental fears, the needle fears, the phobics, but there's a lot of other patients that you wouldn't think of. Gaggers really need to be sedated.
Oh, yeah.
We have a lot of what we call TLC patients that need a little extra care, and those would be our special needs patients, dementia patients, Alzheimer's, and we've been doing a lot of PTSD.
I bet.
We have other patients with just sensitive teeth that can't get numb or they're allergic to the anesthetic. So there's a large range of patients that would benefit a lot from sedation dentistry.
What type of monitoring is going on?
Well, obviously you need all the monitors. So we have more than is required by the state, but you'll be hooked up to the EKG, pulse oximeter. We use capnography now, which measures the CO2 out of your nose, and then the obvious, you know, the heart rate, blood pressure, things of that sort. So you'll be hooked to all the monitors. You're still breathing on your own, so we don't have to intubate.
Okay.
So it's just like if you've had your wisdom teeth out and you've been sedated, or you've had a colonoscopy and you've been sedated, we use the same medications. And all the medications we use in the office are all reversible. So at any time we can reverse the effects if we need to.
Okay.
So a little safety margin.
Yeah, so obviously if you're going to go through this, you've got to get somebody to bring you to the dentist's office,
That's right.
correct?
You need a caregiver, yes, that can bring you, stay with you, and then take you back after the procedure.
And how's recovery after something like that?
The recovery, you'd be amazed. It is really, you'll have no recollection, so it has an amnesic effect, so you're not going to remember anything, which is great. And usually if we're doing harder procedures, root canals, extractions, things of that sort, we'll also have a narcotic on board, so when they wake up they're not going to be hurting, and we usually give a little long-lasting anesthetic before they leave, so they can go home, take a nap. When they wake up, they're not hurting. They can take our prescribed medications, and you'll be amazed. These patients, we can do full mouth extractions and put dentures in one seating, and they won't even take a pain pill that night. So it's amazing. Do
you have to be a certain age to be able to qualify for this?
There is sedation for all ages. We only do adults 18 and over.
Okay.
In our office, just for the safety margin, again, we are licensed to do more, but that's what we do.
Good to know. Okay, and how many locations again is this available
We
at?
have number 6 in progress, but we have 5 going now.
Good stuff. All right. Thank you very much. For more information, head to happydentistry.com, or to request your free sedation kit, go to freesedationkit.com, or give them a call right now at 813-DENTIST. Dr. Monticciolo, thank you again.
Thank you.
We'll be right back.